thing that's happening in the Party City is actually happening in the medical community. Most physicians just don't realize it's happening until it's too late. It's been creeping into healthcare for a very long time. We just wasn't paying attention to the signs. And it's only going to get worse. So if you're in charge of keeping a medical practice alive, stick with me over the next few minutes, and I won't have to convince you it's creeping into healthcare. You'll be able to see the signs and recognize it for yourself, and you'll be able to see that it's already here. But I'm not here just to let you know that it's creeping. I'm here to help you assess whether or not you are one of the practices, the private medical practices, that don't realize this is happening to, just because they are able to pay the bills and pay their staff and people are actually coming in. They don't realize yet that they're losing. So I'm going to give you 4 critical questions to help you assess whether or not you could actually be the next one to possibly close your doors. So it's Christmas. We all know that Party City just announced that they were closing their doors right before the holidays. So that got me to thinking, like, these people been in business for 40 years. There is absolutely no way possible, I would hope, that they would want to treat their staff like this, right? So then I started seeing video after video, comment after comment of people saying things like, where am I gonna get my party supplies? What am I gonna do now? And I was like, how is it that people actually want what you sell? You have it to sell, but yet you're closing your doors and going out of business. That didn't make sense to me. So I started doing a little bit of research, and I found out they were bought out by a private equity firm. And that was all that I needed to know. The way that private equity firms work is they swoop in, they strip the business of its value, and leave behind nothing but debt. Nothing but debt. I have seen this exact same playbook done in healthcare over and over and over again in my 20 years of nursing. I've also been a leader that was highly frustrated with it. So if you are a medical practice leader, this is a warning for you to wake up and smell the coffee before it's too late. So let me see if I can break this down play by play and explain this. Just a warning, I'm a little over analytical. So if you have any questions, make sure you comment down below and I'll go further into detail. So here's how it works. Private equity firms take over companies by loading them with debt through something called leverage buyout. This is basically a process where the PE issues bonds against the combined assets of the two companies so that the assets of the acquired company can be used as collateral. The private equity firm does not carry the burden of this debt. The company, the acquiring company, does. So basically, Party City would have had this debt to acquire. And so then you ask yourself, why would a company do this? Well, they're trying to stay open. They're trying to save their company. They think that the private equity firm is going to be their lifeline. They're trying to do things like make payroll, like get in inventory or supplies or whatever you guys need to do your job. They're trying to keep the doors open. So the firm is going to come in and give them money to do this, and they're going to use their assets as collateral for it. So once the PE firm is in control, the next thing to do is to cut costs and sell off anything valuable. They're doing this to gain capital. Stores close, staff get slashed, prices hike up, pay decreases, investments in growth and innovation, forget about it. In the medical community, the medical organization gets corporatized. Patient care takes a backseat to profit. This looks like that time at the hospital where all the supplies were changed to a cheaper version that was less as effective and nobody cared even when the doctors complained. This looks like pressure to see more patients so that you can bill for more services at an expedited rate while expecting 100% accuracy in charting. This looks like physicians being told what procedures, what type of devices they can and can't have for their patients, what medications they can and can't have for their patients based off of some made up thing that has nothing to do with the doctor's opinion. Because that doctor's way or his opinion is not profitable enough for the organization at this point in time. So we don't care what you think is good for your patient. You're going to do what we find is more cost effective. Sound familiar? This looks like understaffing on purpose based off of some numerical metric made up by corporates upstairs instead of people actually on the floor who know that it's not safe. This looks like rushed appointments. This looks like unsafe patient-nurse ratios to make sure that we're profitable tonight. So then after all of this is going on, usher in burnout, morale plummets, and up goes the increased decline in patient care. This short-term thinking fattens the PE firm's pocket, but leaves the organization crippled, unable to compete, adapt, or even survive. But in reality, it's actually the beginning of the end. Because what should have happened when they started to sell off assets is they should have taken that money and reinvested it back into the company to try to enhance the actual company that they just bought. But more than likely, it's probably not going to go down like that. What's going to happen is they're going to create a monopoly against you, the company that they just bought. So a monopoly is essentially when a single company comes in and is able to dominate the competition around it, the market that it's in, its particular market, right? An article from the New York Post dated back in 2023 discusses how the founder of Party City blamed the private equity firm for the bankruptcy. He claimed they made them change their supplier to a supplier that was actually owned by the private equity firm. They made him get 80% of his supplies from this firm. Then they jacked up the prices of the supplies that he was getting from them while jacking up his prices to his customers when he was known as the Party Discount Store. And then they didn't have a lot of variety, which made him less competitive. In the medical community, they're controlling the money that's going in and out the same exact way. Not only are they buying out hospitals and private practices, but they own managed care insurance companies that reimburse those organizations and home services for seniors that treat your patients. So now after they've taken control of the organization, they begin to affect your revenue hard. You only work with their in-network providers, no matter the quality of their doctors. And think about in the future how that will look when reimbursement becomes 100% value outcome based. I wonder how that will look for the insurance company versus your organization. And so now does it make sense when every time your patient was in the hospital and they got put on this rotating home health company? Is it also becoming clearer now why it's so hard to find a home health company to take care of your patients like they're supposed to? And then whose outcomes is that affecting? Your organization. And then the insurance company gonna turn around and penalize you when it's their actual people who's not following through. Private equity firms do not think long term. They want to cash out in 5 to 7 years, making as much money as possible in the interim, and then move on and rinse and repeat. So they cut corners, reduce staff, and prioritize profits over sustainability. Once the private equity gets involved, it's really hard to undo the damage, nearly impossible. Practices get sold multiple times, more administrative headaches, and the constant pressure to meet unrealistic financial goals. And if you think this won't happen to you, think again. Many physicians don't even realize they're vulnerable until it's too late. This is really a no-risk situation for them because even if the company loses, the private equity firm still wins. They're still gonna win. In 2012, there were 816 physician practices owned by private equity firms. 9 years later, in 2021, there were 5,779. That is a 608% increase of private medical practices needing to be bailed out by private equity firms. That's a 608% increase in doctors who lost autonomy over their organization when they probably thought they were getting help. So with 608% increase in private equity firms over that almost 10-year span, According to American Medical Association, the number of physicians working in private practices decreased by 13%. 13% lost in a decade. That's interesting. Now that they're headed towards a value-based outcome reimbursement model, comment below if you think this is good or bad for you, or if you haven't even thought about it. Because no matter what your answer is, it does not have to be this way. Healthcare is changing and it's evolving. And if you are a practice leader who wants to remain or become a stable private practice, you need to be proactive in this approach instead of reactive. You need to be ahead of the game. This isn't just about corporate greed. It's about your patients. It's about your staff. It's about the future of your organization. You can recognize the early signs of being in trouble by asking you and your staff the right questions and getting the right data. By getting the right data, you're going to be able to protect your practice. It's just that simple. Because you'll be aware of what's going on. You won't be leading yourself blindly. Looking at your office experience, your patient workflows, bottlenecks, and your financial health, those are all some of the main areas that you can start to look at that can put you on the stable path immediately. You will get clarity and understanding to be able to make data-driven decisions. You need to know exactly where your numbers are. This is not a free clinic. This is a business, and we're going to run it like one. Profitable business. And you can't be profitable without knowing your numbers. Stated by my favorite TV mentor, Marcus Lemonis. You have to know your numbers. Without knowing your numbers, you don't know how good or bad you're doing. And that's exactly what the private equity firms are banking on, that you don't know what's going on in your business. And they can come in and feed you fluff and make it sound all pretty when they're going to rob you blind right in front of your face, telling you they're going to help you the whole time. So if you are a private medical practice leader, the time to act is right now. And you want to start with these 4 critical questions. Number 1, do I track whether or not our treatments result in measurable patient improvement? Number 2, do I understand where the biggest bottlenecks are in my patient workflow? Number 3, what are the top 20 reimbursement diagnoses that my organization sees? And number 4, have I identified inefficiencies that are draining staff time or reimbursement potential? These 4 questions hit the main 4 areas that are going to help you succeed, or at least get a clear understanding of where you need to work first. They're the foundation of protecting your practice from the same fate as Party City. You or somebody in your office should know this, and you guys should be looking at it quarterly. You should not be waiting on any insurance company to tell you at the end of the year how good or bad you did. You need to be ahead of the curveball, especially if you plan on staying a stable practice that is transitioning into the outcome reimbursement insurance model without a choice. They're headed that way. United Healthcare is already doing it. And it's basically just going to be another way to deny you claims. So if you're watching this and you don't know the answer to this, or you're not the person who is supposed to answer this, or if you are that person, I'm going to make this real simple for you because I want you to take action immediately. Comment proactive down below, and I will send you this in a Google Doc. You don't have to give me your email credentialing or anything like that. Just comment proactive on something I can DM you, because I don't know if I can DM on TikTok. But comment that below. I will send it to you in a Google Doc, and then you can copy and paste it into an email and send it to who it needs to go to. And if nobody in your office knows, come back and I'll tell you the first step to start monitoring where you think it is. Answering these 4 questions will help you uncover inefficiencies in the top areas affecting your practice. The future of your practice, your patients, and your staff depends on the actions that you take today. Let's get started. Comment proactive below and I'll send it right over.